My name is Girish, the host for Back to Basics, another Back to Basics for another week. Today we're going to be talking about eye care. No, not the eye and the care, but the eye care that we see. And it's very needed, isn't it? And what we need to do to take care of our eyes. And this doctor is here in the house for sure. And Dr. T has been a massive fan of Back to Basics, and I'm the fan of hers. And she's just an amazing person. I talk to her almost every other morning, and she preaches and she talks and she gives you some educational stuff when it comes to eye care and what you need to do and what you don't need to do. And she has some jokes here and there too, but she's quite funny, let's put it that way. So let's bring Dr. T into the house, and I'll call her Dr. T throughout the episode. I won't call her by the real name because I know her by Dr. T, and I have the privilege to say that. So Dr. T, how are you? And thanks for coming to Back to Basics.
Oh, thank you for having me, Girish. It is a pleasure to be here.
Yeah, absolutely. Pleasure is all mine. Thank you so much. So, Dr. T, before we talk about the eye care and what you do and what you don't do, and you do a lot of stuff, by the way, what does Back to Basic mean to you?
Back to basic means, just starting from ground zero almost. I think sometimes we overthink things and we don't keep it simple enough,
Right.
especially for the times that we live in. And I do that, I call myself an let me overthink this type of person. And so back to basics is just basically making sure that everybody understands and communicates on a level where we're all on one accord.
Yeah, thank you. Thank you so much for explaining that in your own words, and thank you for coming on the show. You know, how is it complicated just for eye care? Why do people make it too complicated? What are your thoughts on that?
Wow, I think even like in school, like I always tell people, I've learned so much being in school. When I became interested in the eyes, I was always interested in becoming a doctor growing up. And then I was introduced to the world of optometry by attending a minority summer program while in college. And I figured that, these two organs, yes, they are organs, are very small. They shouldn't be that complicated and easy to learn. So let me go that way, right? But the left eye is controlled by the right hemisphere and vice versa. So it's complicated because it's kind of backwards in some instances. But there's ways of helping patients and helping the masses understand the importance of eye care, the importance of health on a basic level. And as doctors, I think we need to learn how to do that. Stop being so much in the books per se and actually meeting people where they are.
Yeah, thank you so much for explaining that. Let me ask you this here. You know, moms and grandmas and all the histories of the family, they keep on saying that you're supposed to eat carrots to make it stronger. Is that a true statement, or is that one of those things that we just say?
I think that is an urban myth, but if you eat healthy, that helps with the overall health, right? And so there are things that are in carrots that help to, help with like macular degeneration and things of that nature. But we definitely want to say that yes, eating your carrots will help your vision, but it will help you overall health as well.
Yeah, thank you again, because that was a myth, and I thought I'll just ask you for the hell of it. So thank you again for that. You
You
know,
don't want me to go to the other one,
which one is that?
the marijuana.
Oh no, of course not. Of course not. We'll put that on a different podcast for that.
Yes.
Thank you again. So we all say 2020 vision, and 2020 vision means that you can see everything, read everything, and do whatever. Is that a true statement, or is that what we usually say?
Well, the irony of that is because of what I do in the communities in which I serve, a lot of times people say that they can see. That is absolutely right. We can see, but it's how clear is that vision. And so the rule of thumb, how we are visualizing and testing you is based on 20 feet. And scientists have developed what they call letter points at a 20-point letter. And so with that, that's where we get 20/20, because we measured your vision at 20 feet and you were able to read a 20-point letter. There's also 2015 and there's 2010, which are smaller letters from the 2020. But with that, people will often say that they can see, but they're not realizing that in some ways that their vision might be obscured or a little blurred. Especially some of my babies in school, they're like, I can see, I don't need glasses. And yes, you can see, but you need help to see a little bit better based on the measurements that we go by, the standard of 2020.
Yeah, so the explanation that I got is 2020 is usually the HD TV of how clear do you want to see it. Is that
Yeah.
is that better definition, you
How,
think?
yeah, that's probably today's terminology, but I would do the high def or the HD TV would be actually better than 2020, actually.
I
It would
see.
be 2010.
Yeah, thank you again. These prescriptions that we get, like -1 and -4 and 4 and all that. So what is that as compared to 2020? How does that translate, if you don't mind?
So basically, those numbers basically measure the amount of medicine, quote unquote, end quote, we need to put in your glasses to get you to 2020. And it actually is determined by the shape of your eye. That minus, you're in the what we call myopic or nearsighted realm. And if you don't have a minus but a plus in front, your eye is shorter and it's in the hyperopic or farsighted realm. And so, with that, we have those measurements because we need to get your image or the things that you're seeing, which is on I would say, the film of your eye, which is called the retina. We need that image to be clear on the film. And so that's what the minus and the plus. It's optics.
Yeah, thank you again for explaining that. When we go outside into the sun, we say UV light is this and UV light is this, and it's not good for your skin, but it's also not good for your eyes either. Now, how much is how much? Or if it's cloudy, we still have UV lights, right? So, how do we protect ourselves? Now we're talking more on the skin also and eye also at the same time. So, I guess we just have to be careful on that skin part. But what does it do with the eyes? What are your thoughts on that?
So you have the UVA, UVB rays that come from the sun, and those do affect the eyes. And our eyelids are the actually thinnest parts, which is another organ. Your skin is an organ, is the thinnest layer of that organ. So it's getting a beating throughout our journey called life. And so those need to be protected from the rays as well as the eyes. Research has found that the more that we're in the sun, UVA and UVB, that the lens in our eyes will get a little cloudier a little bit earlier. We call that cataracts. And so that's why we tell people to wear sun protection. Have your kids wear sun protection. It protects you from the harmful rays from the sun. And with the skin, you can, basically make sure you're using sunscreen. And we have, I develop products or vegan products that I launched the skincare line last year, specifically formulated for the eyelids.
Wow, awesome, awesome. Thank you so much, Dr. T. When we go to these dollar stores and these Walmarts and get these cheap sunglasses, they're not actually UV light sunglasses, are they? I mean, we
No.
have, right. So we just have to be careful with certain ones. So uh, what do people need to look for when it comes to sunglasses?
So I would have to tell you that what you're talking about is just pure blasphemy. Um, these things that are over the counter, there are no regulations. They can be labeled as that or just that. I highly recommend that you go to an eye care professional, making sure that you're getting quality lenses put in for the protection of your eyes. These things that are over the counter, they're not good. I'm just gonna leave it that way.
Yeah, of course. I just wanted to.
Even the readers are they're just not good.
Well, I mean that I was gonna come to that point. So if we go to any dollar stores or any stores to buy these reading glasses, are they good for you or making it worse?
They are actually making it worse, in my opinion, in my professional opinion. I think we need to really call it what it is. A lot of times people are not going to the eye doctor because they think glasses are so expensive. And so, what I would tell you is, we are moving into this electronic stage. And what I do with my patients, if they don't want glasses from me, I don't have a problem with giving them their prescription, educating them when they're in my office, doing that recommendation while they're in front of me so they know what they can order online. So that way we're all good all around.
Yeah, guys, just an FYI, whenever I have any eye questions, I usually go to her, and she
Yes.
gives me some tips here and there what needs to be done, and she tells me all the time, get this crap out and do this. So believe me, she gives me good guidance when it comes to that, and she's
Yes.
absolutely right. So Dr. T, I just wanted to talk to my audience 1 second. There are reading glasses and there are sunglasses which you need to go to the eye doctor for. But keep this in mind that most of these reading glasses, they also have blue blockers, which means that it blocks your phone light, your laptop light, or monitor, or whatever light is out there. Even tablets too, by the way. So regular stores will not have that, and I think the eye places they have that. So what am I trying to say? The doctors are the way to do it, and they'll guide you in a better way. Obviously, they're here for a reason to guide us, right? So, Dr. T, thank you again for that. You know, is this what type of exercises do you think that we can do for the eyes? Besides obviously eating well, but what are the eye exercises? I mean, I've been told that you roll your eyes left, right, center. Yeah, okay. I don't know if that makes it better or worse or dizzy. So, what are your thoughts on that?
Well, there is something called vision therapy that we can do for the eyes, but usually those are related to those I guess ocular disorders related to your eye muscles. Like some kids might be born with a weaker um, eye muscle, or if you've had a stroke, it weakens your eye muscles. So we would usually send people to vision therapy, just like we would send somebody for like physical therapy. So there really aren't actually things that you can do or exercises that you can do. But what I do recommend is something that has worked. And if we're on our tablets, on our phones, we're constantly on these computerized devices. Take 20 minutes to look 20 feet away, um, so that you can reprocess, right? So every 20 seconds, look 20 feet away for so that you can reprocess and come back. And that allows you, number one, to blink and get some more water and your tears to move throughout your eyes, as well as just refocus, right? Refocus.
Yeah, thank you again. I mean, I don't smoke, but I call it the 15-minute smoke break. Walk away from your laptop and then come back again. I mean, that's what it is, right?
That's
Technically.
basically it. Yep.
Yeah, yeah, yeah. So thank you again for explaining that. You know, these these cataracts that we get in older age or even young age, depending on how bad is the eye, how what do we need to do to prevent from that? I mean, or there's no way out. I mean, we have to get it done.
So when we're talking about cataracts, I just want everybody to know, if God blesses us to live long enough, we are all going to get cataracts. That is a normal aging process, similar to what most people say, that arthritis or that back pain or that knee pain, right? Though that's the wear and tear on our eyes. And so eventually you will come or see your eye care professional and see that, hey, you're going to need cataract removal. And we've kind of changed the terminology from cataract surgery to lens replacement. Basically, what we're doing is we're taking out that lens that has fogged, almost like um, I usually say, if you think of how you want to chill a glass, you wet it and you put it in the freezer. When you take it out, it gets frosted. That's kind of what happens to our normal lens. And so what happens is we take out that frost and we put in a clear lens, almost like replacing a window.
So what is the difference between that and latex? I mean, isn't that the same thing? I mean, you're slicing. the lens also, right, to see better, or is that something different?
No, that's something different.
Okay,
So,
can you explain that if you don't
yeah.
mind?
So your cataract is the lens inside of your eye, which is actually behind the iris. And that as we get older, that gets hardened and cloudy. And so what they do is that they do a phacoemulsifier, and they're actually breaking that lens up as they're doing the surgery, and it's getting sucked out. And they just put almost like an internal contact lens inside in its place. LASIK, on the other hand, is dealing with the cornea, which is the very front part, which I would say almost like your very front window pane. That one has to be clear at all times. And so with that, what they're doing is they're taking the thickness of that lens and they're modifying it through laser to improve your vision.
Wow, that's amazing. Thank you so much, Dr. T, for explaining that. Because you know what, some people they were saying that I don't want to get LASIK because I think it's good for 10 years only, and then we'll have to do it again. But then, should we do that again, or should we just leave it?
Well, you have to think LASIK really just started. It became really popular. I've been out of school for, I've been in practice for 23 years. So probably about 25 years, LASIK has really started. So it's fairly new. So if they had to get a go back in for restructuring the cornea, then that's that. But on the other hand, I think a lot of people fail to understand that these are ways to improve your vision, to make life a little bit easier for you, but it doesn't take away the fact of what God gave you, whether or not he made you very, very nearsighted or farsighted. These are the things that you have. And so I remember a patient, while I was in optometry school. She had LASIK surgery, and her thing was she didn't care that she had to wear glasses. She just was happy that she was able to roll over and see the alarm clock. So again, it's the perspective of the patient. What are they trying to get out of it?
Yeah, it really depends on the motive of whatever they want to do, right? I mean, it's
Yeah.
really personal to personal aspect of it. Totally true. Thank you so much for that. Now, glaucoma is another big one that people they they talk a lot on. Now, I have been watching certain people's reports online, and it seems like the younger you are and now you're getting glaucoma versus back in the days it used to be older. Why is that? Is it because the environment changed, or our eating habits is bad, or what do you think? What are your thoughts on those?
Well, part of it is we're living longer. So glaucoma is also one of those diseases that there are many factors involved in it. It can be age, it can be familial history, it can be genetics, that's familial history. It can be trauma. It can be a whole bunch of things. It can be medication, high blood pressure, diabetes. Those people are at risk of developing glaucoma. And so that is my wheelhouse. I love glaucoma. But yeah, those are some of the risk factors of getting glaucoma. And again, if we're living long enough, you probably are going to start seeing those changes in the ocular structure in order for us to start seeing that the pressure in the eye is going up.
Yeah, thank you again. I asked that question like one of the mornings, and you gave me a whole lecture on it, and it was just amazing. So
I
thank you
love
again for.
glaucoma.
Yes, I know you do. You're very passionate about that. So let me ask you this question. I think I've asked you this before, and we talked about the colorblind. Okay. Now, is it more male oriented or female oriented? That's the first question.
More male.
More male. And
Hmm.
what is the cause of that? Is that more genetic, or is that more what?
I would say it's more genetic.
More.
We more genetic, yeah.
Thank you again. And then there has been some videos and there has been some theories that if you can just wear the color, sunglasses, and then you'll see the color. Is that a fact, or is that false? From your thought process. I mean, there's no right or wrong.
From my thought process, I would say it's false. What the glasses will actually help you to do is to identify what's going on. So, for example, we can put specific glasses on you so that when you're looking at if you have red green deficiency, you'll be able to look at the street light and be able to detect that street light is on. But will it say that you'll be able to see the red? No. Will you be able to see the green? No. But it will allow you to detect that light is up. Yeah.
But then how can you, I guess I'm just being a consumer. How do I know that if that person can see the red and the yellow and the green? I mean, think
Again,
about that, right?
that goes back to one, we do an analysis of your rods and cones. That's where that comes from, your rods and cones in the retina. And then that will determine how we treat you. I think they are working on some internal procedures where they're actually putting a chip inside the eye, all that good stuff coming down the pike. But I think initially it's just hereditary. And that's why if you see some men that they may just wear dark blue and the grays and the black, you never really see them in color. That's more than likely either they just like the color or they're colorblind.
Yeah, thank you again. And when you're colorblinded, you only see black and white. Is that right, or is that wrong statement?
That's a wrong statement.
Okay. Because I have seen online that that's what they see, but I think with your example, what you gave before, that's not true, is it?
No, because it could be various levels. That's why we say it's a deficiency. So they may see some color, but they may not see it all. So
Yeah,
yeah.
yeah, yeah. And then obviously right now there's no cure, but then you said that there might be later on. Is that correct?
Yeah, they're working on some stuff.
Yeah, yeah, yeah. So thank you again. And one last question. I know that you'll have to run for somewhere else, but reading at nighttime in a night light, that's not good for your eyes. You're actually straining the eyes, right? So
That is not
so
good.
how do we explain to the folks that, it's not good for you, and what is a good practice?
Well, the better the light, I mean, you need light. So let's just put it that way. You just need light because you need to be able to see the contrast. The good thing that we have is a technology, because if you have a nice computer or a computer that has that backlight where you can get the contrast and the definition better, it's good. And like a Kindle reader or things of that nature, that will actually help. But if you're trying to read and you don't have those devices, you need light. You need the overhead lights. You need a lamp or something like that, because you need to be able to see what you're reading so you're not overusing your eyes.
Wow, awesome. Thank you so much, Dr. T, for explaining all the stuff that we have talked about, the eye care of everything else that what you do. And now we have not even discussed, and I just want to talk very little, if you don't mind. You are also a pastor, and you say amazing words every morning whenever I chat with you. Where did that come from, and how did that start? And I guess that brings you peace and harmony in your life. But where did this whole thing start for you?
So first, I'm not quite a pastor yet. I am a minister, but I can't say I'm a pastor now because my pastor just made me youth pastor actually this week. So
Awesome, congratulations.
that is good. No, I think it's kind of something that I was always striving for spirituality, for faith, and I got saved, as they say in the Christian world, when I was in college, and ever since then, I was always active in church. And so, where that came from, I think it's just a matter of answering what I call that gut feeling that God wants to take you into a different place. And I've talked to some friends, and I've actually ran from the calling. Is that's what they say in the Christian faith, the calling. I think I've been running from it for a while, but a pastor friend of mine said, "Listen, you probably given your best speech and outside years and years ago." And so when I was practicing for my first sermon, I was really, really nervous, but that's pretty much what they said. But I think in general, I think having a foundation of faith is crucial as an entrepreneur, and just life in general. I think it gives you direction, it gives you focus, and it has a space of um being grounded, that there's still hope. I was talking with a colleague of mine who practices Islam, and she's from her family's from Palestine, and we were kind of talking about the same thing. And she was like, "Oh my God," and she was like, We were literally saying, we got to go to Palestine literally after having the conversation. So I'm Christian, she's Islam, practices Islam, but it's all good. I think having some type of faith and spirituality helps you with this journey called life.
Yeah, thank you again. You have an eye for life, and then you have this other side of life that you just connected to, and it seems like I think these two things are calling for you for happiness. And I think whenever I chat with you, no matter what nonsense you have gone through every morning, you always smile and you always come up with amazing words. So thank you again for Dr. T for coming in the mornings to do that, and then plus coming on my show and making this brighter for me. But before you leave today, Dr. T, do you
Yes.
have quick words for all my listeners and my viewers? Any last words? And how was your journey on Back to Basics here for you?
For all the listeners, again, thank you, Girish, for allowing me to be here on Back to Basics. I think this is a crucial thing. What you're doing in the community is amazing. I think we need to be on that grassroots level, because that's the type of person that I am. But for all of those that are listening, make sure you're getting your eyes examined every year. I don't care what the insurance tell you, every year, even on babies, every year. Make sure you're getting your eyes examined. Stop using those over-the-counter dollar store things. If in doubt or you question anything, seek out an eye care professional. Don't let it wait, because there are a lot of things that we can treat and really get you back up visually um, quickly. I know a lot of times people come to my office and they'll say, "Oh, I was rubbing an eye and I realized I wasn't seeing that out of that eye." And that's when we're noticing the different medical problems. So just make sure that you're getting your eyes examined every year. On that note, and then just live and enjoy life, and just take it back to basics. This has been amazing being here on the show, and thank you, Girish, for having me.
Thank you so much, Dr. T, for explaining that and just being here and and just being here for me and supporting me and my podcast. And I'm very very grateful, Dr. T, for you coming here. And I know that you had a crunch time, but thank you again for coming here.
Oh, you're welcome. And you can always follow me on social media on Instagram at 2020 Eye Doctor.
Yeah, absolutely. And by the way, guys, I'm following her on TikTok too, so she's on also on
Oh,
TikTok,
yes.
and she has not been that active, but I've been promising her and telling her and pushing her at the back, like poking her and saying she needs to do it, she needs to do it. So she will
Yeah.
eventually do it. So Dr. T, thank you again for coming here.
Thank you so much, Girish. Be blessed.
So, guys, we spoke with Dr. T and we talked about the eye care. And yes, there is a quote of the day from Back to Basics, and hopefully my guest will like that. Now, before I say that, eye care is the most important thing in the world, because we live once, we die once, we want to enjoy the life the way it is, right? And we see all these beautiful colors and beautiful world. You want to see each other. Yes, there are people who are colorblinded and not able to see all the colors, but life is there for you, which is in front of you. Now, as usual, as always, there is a quote of the day, and hopefully Dr. T will like this. Everything that is made beautiful and fair and lovely is made for the eye, for one who sees. Now, guys, as usual, as always, what do I always say at the end of the episode? Everything in life goes back to basics, and that's what we did today, guys. Guys, take care, God bless, and I will see you next week on Back to Basics. Keep on commenting on all the episodes, including this one, because it'll help me to understand that you're listening. And there are three things in every episode, including this one, makes it hit for me, which is the content, the guest, and definitely the host. Guys, take care, God bless, and I will see you next week on Back to Basics. Next week's episode on Back to Basics.
I want people to know the importance and how factors like your physical strength connect to things like your emotional well-being, your social well-being, even things like political power. They're all really interconnected in interesting ways. And I got to dig into that in the book, which I I think that we kind of know, like, oh, you know, if you're healthy in one area, you're healthy in the other. But I don't think that even I knew before I started writing this book how interconnected all of these things are. And so I think it's just